pandemic, right, is that there's a second surge happening in different parts of the world, right? And
Right.
India is no different, right? We've been
Hmm.
reporting numbers of 40,000, 50,000 new cases every day. So
Hmm.
which had gone down to as low as, some 10, 12,000 some
Hmm.
time back, right?
Hmm.
And we are really not seeing a different, we are not even seeing the level of, control and the level of, restrictions that were applied in the first time, right? And it seems like a much freer movement of things. I mean, my complex is much freer. The roads are very different. The government rules and regulations are not as strict anymore, right? So I wanted to learn about, this whole, similar situation, but a different government rule or role in the
Hmm.
second surge, and how we can therefore design this environment so that the second surge can be controlled rather than kind of taken too lightly, right? So that's the context in which I'd like to hear your and Ram and Shekhar and Omar.
Hmm. Ram, you've unmuted yourself. I'm sure you want to. You're itching to talk.
That's much. I think uh, one obvious thing is that some of the harsher measures that were imposed earlier are extremely unpopular. We've seen even in Germany, I think they went back on some of the Easter restrictions. Uh, so strict lockdowns are a strict no-no. I think there's a significant pushback from public because of fatigue. I think it's also largely in terms of expectation setting. At least here in the US, as 2 weeks to slow the spread, or we're only doing this to increase capacity. So some of those arguments as to why you need a lockdown, if it is that we are running out of hospital capacity, it's no longer a valid kind of a reason to impose a lockdown. That is one.
Hmm. Hmm.
Probably a more persuading thing is more virulent kind of variants or uh, uh, variants that are spreading, faster or killing more people. So I think from an administration perspective, you need a new story for lockdowns. I mean, there are several things in terms of fatigue, uh, public pushback on government accountability, and so on and so forth. The other aspect is that we are likely to see much lower death counts than before.
Hmm.
Uh, and that's due to a combination of factors because some of the high risk population has been vaccinated. Uh, at least in the US, the existing treatments are highly effective. I think some of the antibody cocktails are like in the high 80s or close to 90% effective in preventing death. So the number of factors that will contribute to fewer deaths and all of this will kind of contribute to a lesser risk perception. So I think maybe some of the lesser harsher measures like masks and distancing can be promoted, but lockdowns, I think it's a challenge for governments. Lastly, I would say this is a good opportunity to deal with vaccine hesitancy. We've been doing significant work on that in India and in the US. One of the reasons there is, I mean, we're not talking about anti-vaxxers, but there is a little bit of indifference and procrastination towards the vaccine in India, largely because the pandemic was assumed to have vanished.
Hmm.
I think with this increasing surge, I think it's a real opportunity to expedite uh, vaccinations and make sure that much of the high risk population is vaccinated as soon as possible. Uh, in that way, even though you will have cases, you will not have a lot of deaths.
I
Shekhar?
think to add to Ram's point, I think right now is probably it's double whammy for people because the cases are rising, and
Hmm.
a lot of population who is mobile now, who is uh, having to go out and interact, they don't have the ability to get the vaccination, at least in legal channels, at least in India. So that scarcity might also drive up a lot of, drive away a lot of this hesitance, which is interesting. Hopefully, this surge, we will open up some of that vaccination route soon enough so that that current scarcity that people feel can be utilized to push people away from that indifference and hesitation. I feel that economically also everybody's it is increasingly clear that we can't go for mass lockdowns that we saw last time, but I think there is an increasing acceptance of point lockdowns, or not to say lockdowns, but point measures like upcoming festival Holi is a
Hmm.
prime, it's a prime candidate for increasing serious spread with really proximate, uh, celebrations, water, and everything, right?
Hmm.
So there is probably a lot more targeted, pointed measures to be done than mass lockdown for months on end.
Hmm.
Interesting times.
Yeah, actually, if I may bring a point out from this, what the Singapore government did, right? Across the world, it was called a lockdown. And what really worked, I think, over here, of course, that people are quite, they follow the rules and everything. But apart from that, it worked. What worked was it was called a circuit breaker and not a lockdown. And that put the lockdown was like a up top down kind of a thing that hey, I have to follow these rules and I don't really like them, versus circuit breaker put the responsibility in the that individual's hands, right? So you are the circuit breaker. If you stay home, you can break the circuit. So I thought that was a very, very interesting thing that this did. And the second thing that they did was they imposed not like full lockdowns after a while, after the situation got a little bit better. And they didn't open it up either. But what I don't know how other countries dealt with that kind of a situation very well. But what they did was they actually said, okay, five people can meet, up to five people can meet, right? Even in your houses or even outside, up to five people can meet. Then they increased the thing till to up to eight people can meet. So they slowly opened it up, and I think even if say eight people were meeting when five people were supposed to meet, there was that in their back of their heads that there was this lingering sense that there is this number, that there was this what do you call that in thing, there's a anchor, right? That there was that was set five people, so 15 people at least will not meet. 8-10 people might meet because five people have been said. So at least more people would not meet. So I thought those two things were quite interesting what they did.
Aman,
Anyways,
how do you see this redesign for the search? I mean, what's your views?
uh,
Uh, is that me? Were you
Yeah,
talking to me, Anirudh?
yes, I was.
Okay. Yeah, just a couple of things I've had in mind. First of all, Ram mentioned COVID fatigue, and I think everyone is feeling that at this point. Also, just to quickly let everyone who's listening know, I'm based right now in Johannesburg, South Africa. I was in Singapore for most of last year, but I came back in September. So I was there for the circuit breaker, like Jael mentioned. And she had a good point in saying that the Singapore government kind of reframed the idea of a lockdown, and they used the term circuit breaker, and they used different phases. So it kind of, even though the regular person, the average person in Singapore knew that the government was just, you know, kind of using another term when it's actually a lockdown, it went some way towards kind of changing people's perception of it, in thinking, even for me, in my experience, while I was there, I was like, okay, we're not really in a lockdown. It's a circuit breaker, it's a little different, so it's effective in that way. Now that I'm comparing Singapore's measures against South Africa's measures, the thing that is different, I feel, is the culture of adherence to the government's plan. So whether that's in the first instance, there was the COVID prevention measures earlier on, and now where we're seeing the vaccine rollout, people in Singapore are just more likely to go along with what the government is saying. and kind of follow and stick to the rules. You know, in Singapore, they've had the safe entry kind of system where every single place you enter, you've had to put in your details and check in and check out. Whereas here in South Africa, people do not check in or check out everywhere. There's also skepticism around vaccines. People go out and mix with like large crowds. So I think what needs to be done is in terms of reframing things at this point, because it's been a year. Sorry, you can stop me at any time because I'm speaking a bit too much, but the last thing I'm going to say is that it's been over a year since the pandemic started, and I feel like what countries need to do now is kind of tailor their responses and to the local culture and the context. So the response that's happening in India or Singapore won't the responses won't necessarily work in South Africa, if you understand what I'm saying, if you follow what I'm saying. So each country will be a little different in terms of updating the population on how the vaccines work and how we continue to be safe and stick to those safety measures. And yeah, I think that's enough for me.
Shoman, you are definitely not speaking too much. You're making some great points, and there's nobody here who is supposed to kind of monitor anybody, right? But that's like great points, and not at all, right? Ram, in the US, are you seeing any difference in the first lockdown versus now that there was a surge in US again, right? I mean, this is probably a third time.
Yep.
What's been happening from the government and public point of view?
Just to add to what Omar was saying, I think if you look at one way of looking at country-wise strategies is essentially looking at Hofstede scores in terms of individualistic and collective societies. Singapore tends to be a highly collective society where uh, uh, there's much more conformity to larger societal norms as compared to some other countries where you will find high individualistic kind of scores. I think, therefore, one trick most of the governments have missed is to frame their communication based on whether it's a collectivist or an individualistic society. Uh, Two, I think in the US, what has happened is that largely the anchors kept on getting shifted quite a bit. At one point, where 50,000 cases were considered a lot, then 100, then 200. The current anchor people have is something like 300 to 400,000. So I don't think people are going to be worried unless you hit, something like 200, 300,000 cases, uh, which is not going to happen unless the vaccine turns out to be a total dud. Uh, Vaccinated already. Most of the high risk population should be vaccinated in the next few weeks. I think US is staring at a very different story. So what happened in between when the case surge happened is highly targeted, localized kind of lockdowns. It could be at a beach, or if you decrease restaurant capacity. So I think other than like a mass kind of a lockdowns, these targeted, uh, very specific kind of measures helped. Uh, I think that's where there is a little bit appetite for, uh, and where there is high government control, where a restaurant can be told to reduce their capacity by 10% or 25%, or you have further restrictions in terms of testing. The last thing I would say is that to all of this, what is critical is like speed of testing. So that's another thing now in the US where testing is kind of freely available. So uh, I think the general sense in the US is that this pandemic is going to be over. There's latest piece in the Wall Street Journal yesterday saying doesn't matter what Fauci says, we're just looking at herd immunity in the next 2 3 weeks time. That I think is the popular sentiment now, that this pandemic is over largely because of vaccinations. Um and to my mind, that seems like the best way to get out of this is to vaccinate as soon as possible. And you've seen in the US that you can actually do it at a fairly good pace. I mean, it's just, for all practical purposes, 3 months, and most of the high risk population is vaccinated.
Ram, I think for India terms, what's worrying is the spread of mutant strains. Latest figures from Punjab, if you see, 80% of the assays that they've analyzed are showing that it's a mutant strain. Now, the majority of people who have been vaccinated in India, for instance, have been non-Covishield, which is the Oxford AstraZeneca vaccine, right? And effectiveness of that against the mutant strains is another big if. So it's going to be a really, really tough, maybe a month or so. If we, by the time we vaccinate everybody, a lot of this mobile population, and see whether that is actually effective.
That's the only persuasion point left with the government
Yeah.
for some targeted lockdowns, that this is a variant. But I think most of these vaccines do protect against hospitalization and death, though they
Hmm.
may not stop the infection.
Uh, Great. I think it's been a very good conversation, but I think it's just the tip of the iceberg in terms of what we can design for the second surge. And I guess we could, restart this conversation on another day and see if we can actually ideate over here for a while and come up with some interesting thoughts. So, Anurag, yeah.
Yeah, no, before we go, right? So, Ram, how is the playbook going to play out for the second surge, right? I mean, we've got 1 minute, but we can get some of your views on, the playbook that was being developed. Is it helping in the second surge management or not?
So, we've not particularly addressed second surge, but we have addressed it from a healthcare system point of view, right? So, at least if there is a healthcare workers who are extremely stressed, so you need to kind of figure out solutions, either in terms of rotation or stress management, that people who have been through this once, they don't want to go through this, this stress once again. So it was much more from the healthcare community perspective, but we'll update it, in terms of secondary surges, how the messaging
Mm,
should be drastically.
yeah, that makes so much sense, right? So, thank you guys. Any closing comments? We have 25 seconds. Shekhar, Omar, Jael.
Yeah, Anurag, increase the time limit. That's all.
Nothing from me. I think this was a great conversation, some valid insights, and yeah, food for thought.
Yeah.
Thank you,
All
Omar.
right.
Okay,
Great.
Thanks,
I
thank
think
you.
Shekhar.
I'll
Thank
start
you.
another circle like this one again so we can have more time, Shekhar. Bye bye.